Hello, thank you for tuning into this live stream. I'm Echo Mendez. I am reporting for the Edina Sentinel and NemoNews.net and the Nemo News Media Group. I am here in Scotland County at the Scotland County Fairgrounds. There is a free rapid COVID-19 testing going on here in Scotland County, and that is for Scotland County and all of its neighboring counties. So that would be Adair, Knox, Clark, Schuyler, Lewis. Adair, Knox, Clark, Schuyler, and Lewis counties, right? And Scotland County. Anyone that lives in Scotland County or a county that neighbors it has the opportunity to come get a free rapid COVID-19 test all the way to the end of the week. You guys are here till Friday. 8 to 4 every day. It started on Monday to Friday, and today is the 9th, so that would be the 13th, right?
Correct. We do ask that they make appointments first by calling the Scotland County Health Department, just so us and our crew over there.
Anyone who wants to come down here to get a test can call the Scotland County Health Department, and
It's
660-465 7275. And if anyone from the health department is watching this live stream, if you could put that phone number in the comment section to just help people out, that would be great. I just want to say a couple of things. One, it's raining. They're still out here. I am number 72 to be tested. Have you guys had people from all over? Okay, they've had people come in from surrounding counties, not just Scotland County. We're going to live stream what the test is like, just so everyone can see how it works. And I just want to be clear that I started this live stream just a little bit after I pulled up, because there was some paperwork that had to be done. Very short. How many questions, Mason?
So let's see, it's just some general demographics and symptoms. So, total, we usually run through this questionnaire in about 2 minutes.
2 minutes worth of questioning. I think there may have been 3 or 4 questions. What is your name? Where do you live? What is your phone number? And then there was a list of symptoms that they go through and ask, have you experienced any of these symptoms? And it was a pretty good list. I would say at least 15 or 20 different things on there, asking about temperature, asking about, coughing, sore throat, that type of thing, nausea, loss of smell or taste. And while we're talking about this, I just want to also remind everyone, you do not have to be experiencing symptoms to take advantage of this test. Early on, it was publicized that this testing was for people with symptoms only, and that is no longer the case. Anyone that wants to come be tested can come and be tested. All that needs to be done is to call that phone number and make an appointment. And when I called yesterday, I asked for an afternoon appointment today. They were very easily scheduled me right in the time that I needed it to be. Do you have a lot of stuff stacked up, or do you have lots of open appointments? Lots of open appointments. So this is a really great opportunity to come find out if you test positive for COVID-19. And then the results don't happen right this second. I'll actually get a phone call from them within the next about 24 hours with the results of my test. So, okay, they're ready to give it to me, and it's
Have you put your head back? And I'm just going to go up and turn. Perfect. One more. All done. Woo.
that wasn't so bad. I did take a COVID test at in Edina at the clinic. It's probably been a month now, and it was not pleasant compared to what this was much easier than the test that we were seeing at the very beginning. So this is Mason Alley. If you've been watching our live streams, Mason has joined us a lot of times. We do health department updates with Lori Moots Claire. This is the emergency planner for our region, and I'm going to turn this around because... Let's take it off here. I just want to ask Mason some questions, and I want you to be able to hear him.
I apologize if I'm either quiet or yelling. I don't really know my volume control behind my N95.
I can hear you pretty good.
Okay.
So, Mason, now that I've taken this test, tell me about the quarantine guidelines. Does this mean I have to go home and be on a quarantine?
So in general, what we would advise anyways is if you do feel the need to go out and be tested, from the time you have from the time you've had your test taken until the time that you get called of your results, we would ask that you go ahead and quarantine yourself at home. Now, if you're talking about, let's say, family members of the home, so let's say, for instance, husband lives in the home with you, and you get tested and you're quarantining at home, he wouldn't necessarily have to quarantine unless your test result came back positive. If it came back positive, then he is identified as a close contact and then he needs to quarantine. But if we're waiting on your test result and we don't know necessarily if you're a positive or a negative, he's not necessarily bound to stay at home. We would just ask that the person who received the test at that point would stay at home.
So basically, I just go home and stay home and wait for my result. And everyone in my household is not required to also be home too,
correct,
unless my result is positive.
That's correct. And the good thing about this test is as well, they can process 4 tests an hour. So typically, if we're not calling individuals the day of their test, we're calling them the day right after.
So let's talk about getting if there's a positive test result. So you said me and my, all my close contacts would go on quarantine.
Right.
And how long does that last?
So for the case themselves, it's kind of a confusing definition, but it's the best that we've got right now from CDC and DHSS. So for the case themselves, if you're identified as a positive, if you're asymptomatic, it's 10 days from the day that you were diagnosed. If you're a symptomatic case, you have to go, and this is where it gets confusing, 10 days from the time your symptoms first appeared, and at least the last 72 hours have to be fever-free, and you have to have an improvement in your respiratory symptoms. So let's say you were diagnosed on the 1st as a positive and you were symptomatic. So on the 11th, we'd call back, check up with you, and if you were fever-free and your respiratory symptoms had improved, technically you could come out of public health isolation. That doesn't necessarily mean that you would test negative in a future swab, just because what we're finding is, from certain studies out of not only Missouri but other countries, people are testing positive as far out as 88 days on their swab. But that doesn't necessarily mean they're infectious at that point in time. It's just enough to where the actual swab can pick it up on a test. So the best definition for those able to come out of isolation that CDC has given for us is 10 days from diagnosis for asymptomatic, or 10 days from symptom onset with 72 hours fever-free of those last 3 days for symptomatic cases. So let's say you did get to day 11, that was day 10 of your quarantine as a positive and you're symptomatic, and you still had a fever that day. Well, then we just need to call you back in 3 days and see if you've been fever-free for those 3 days as well.
You're right, it's confusing.
Yeah, I know.
But you guys are here to help walk people through it.
That's correct.
And has there been any positive tests out of this particular round of testing?
So far, Scotland County has reported 1 case out of the batch tested yesterday that I know of. That's been reported on their Facebook page. But so far, that's been the only one that I've had notice of at this point.
And I'm number 72.
Correct.
But surely there's still some in the waiting to get through the testing.
I say there could be. I can't give a definite answer if somebody in the batch they're testing now is positive.
No,
or
I
not.
mean that you guys haven't run every single test yet.
Correct. So that's what you may have just seen the gentleman come back behind me and grab some specimens out of the fridge there, and then he's taking it over to actually be processed for testing.
Is the National Guard here assisting?
Yeah. So that's actually who's running our test. I would say I'm going to butcher the actual division. I can't remember if it's the 7th Civilian Support Division, I believe is the ones who are with us. But yeah, they're set up just not far off of our fairgrounds right here. So they actually have grabbed the specimens, they take it over to their vehicle, and then they run it through their machine there. So that's why we're able to get the results back so fast. That coupled with the Abbott ID Now machine that we're using.
Is this the first round of testing like this, free testing for anyone who wants one, that we've seen for this region as far as these rural counties in the Northeast region?
So it kind of depends. For the rapid, I believe so. However, you may have seen some of your other local public health agencies share there are going to be some community tests kind of sporadically popping up and around the area. I believe, for instance, ones I've seen through the health website, I believe Lewis County is hosting one on the 19th at Lewistown, and I believe Scotland here, they're hosting one on the 20th. I can't recall where the location was on that, but lots of the LPHAs, they've been sharing those on their Facebook page, and Department of Health will also have a listing of those on their website.
Okay. Is there anything else you want to add or tell people?
I'll say, again, we're here to serve you guys. This is a free service, so again, if you feel the need to be tested, we're not requiring you to be symptomatic, so just go on, give the health department a call. We'll see if we can find you a time slot and work you in.
Mason, thank you.
Hey, thank you, Echo.
Thank you so much. So I'm going to... Okay, so I'm gonna go ahead and shut this live stream down for now. It's an interesting opportunity, you know, given all the information we have about testing is a good way to get a handle on where the pandemic is in our community. As rural, a multitude of rural communities spread throughout this region, there's not been a lot of opportunity for rural residents to do any kind of testing, because a lot of the attention has put where it's needed to be, which is in metro areas, bigger cities, New York, LA. We've been watching them on the news for months now, and so I would encourage anyone who feels like they would like to know if they're COVID-19 positive to come out and get a test. The reason I do it is because I am an essential worker and I do go lots of places in the community. I try to be mindful and wear my mask and keep my hands clean and all of that. But at the end of the day, the majority of a high demographic of the citizens who live, especially in Knox County, and I think that's relevant for all of the communities around us, are older, senior citizens, and many of our residents are in the highest demographic for being at risk. And so for me personally, I just want to know if I'm exposing the people I love to this virus, and if I am, I want to be able to be the one to put a stop to it, just personally. So anyway, thank you for watching this live stream video. I'm going to go ahead and shut it down for now. I'm Echo Mendez. You were just listening to Mason Alley. He's the emergency planner for the Northeast region, and spends a lot of time in our county, the Knox County Health Department. So thank you for watching, and signing off for now.